Well, 35 years ago, Dr. Sal Pepe and a male nurse, Mario Cuevas, and I were in the emergency room at San Clemente Hospital and saying, look at all these people we're seeing that could be seen in a clinic setting that didn't have to be in the emergency room. And just like today, we have overutilization of the emergency room where we could be seeing these people in that clinic setting. So Dr. Pepe's idea was, let's start a community clinic for those people that don't have a physician or can't get in to see their doctor. And he went to Father Martin, before he was Monsignor Martin at the mission, and said, gee, can we have some space? We'd like to do this. And he took us down to the St. Vincent de Paul, which was just down from the mission, and went in there, and the ladies that were taking, the volunteers that were taking all of the different donations for the day and selling them for the St. Vincent de Paul said, okay, we'll give you these 2 rooms. And that's where they stored their mattresses. So we used one room as the office and waiting room, and the other room was the exam room. And that's how we started, out of those 2 rooms, and we really didn't know what we were doing other than the medical care part of it. When we talk about funding and supplies and the pharmacy, which was very expensive, we literally did start out with the pickle jar, glass jar on the table that said donations. And people would put in a couple dollars or $5. But the business part of it, after a year or so, Father Martin came to us and he said, you doctors don't know anything about business, which is still true today. And he introduced us to the Birchers, Art and Gay, who helped us then move on to our next building, which was down off Avenue Airporte. And it was the old penny saver, which doesn't exist anymore. And we had offices there that were remodeled and a big area in the back, and it was the beginning of a long, long, beautiful road.
It was struggling. It needed a business side. And our pastor at the time came to us and asked if we would come on board to take on that responsibility. Our goal was to put together an organization that could run and allow the doctors to provide the medical care that was needed in our communities. At that time, affordable medical care was not a topic that anyone ever brought up. It certainly wasn't on the news. It wasn't a political issue. It was that unspoken thing, and it just wasn't even considered. But when the need was brought before us, and we saw what was happening at Camino at the time, it woke up that need to give back to the community. We're called to give. We are called to take care of our brothers and sisters, no matter where they are.
And at that time, it was just me and another doctor. And we saw patients of all shapes and sizes and all complaints and a variety of patients. We were seeing patients that would be walk-ins, and then we were seeing patients that would be scheduled appointments.
And we'd go around and people would donate supplies, either from the hospital or both Mission Hospital as well as back then San Clemente helped out with supplies.
When Mission Hospital was purchased in 1994, we really saw an opportunity to partner with Camino and embrace them as a part of the hospital, and created a Camino board, our community benefit committee, and really tried to align and hold up and strengthen Camino Health Center so it could be sustainable in providing increased access to care.
Through our sponsorship with Mission Hospital, it was a really great time for the health center because we were able to stabilize our operations. We really firmed up our mission statement, which was to serve the underserved and the vulnerable, as well as provided us an opportunity to call out our values. Mission Hospital also really provided us the financial stability we needed to continue seeing patients who were completely uninsured and unable to pay for care.
So in 2012, Camino Health Center was designated as a federally qualified health center. And what this allowed is new additional federal resources to come in the community to increase services available to the low-income population in South Orange County. And specifically what worked well about that designation was the ability to marry the federal resources with the resources traditionally received by Camino, which include Mission Hospital and other local funders. So what this allowed was new resources to come in to be able to support this community and specifically add new services or increase existing services. Some of the new services that were added through the FQHC designation include behavioral health and adult dentistry.
With time, our population has expanded, but we've actually expanded more to take care of more of the general population of Southern Orange County, particularly those who used to be insured, who are no longer insured, and who have a more traditional contact with the medical healthcare system, but who suddenly find themselves disconnected and in need of a portal, if you will, to get back into the medical system. With that, Camino has grown to meet their needs. Now, 20 years later, we have 2 family practitioners, 2 internal medicine doctors, and we very recently added a pediatrician. This has also expanded the range of services that we can provide and the breadth of our clinical expertise that we can offer our patients.
In my experience, I think the best thing about being at Camino is really feeling as though we make a difference. We make a difference in this community to so many people that would never get health care, that have come to us and said, thank you so much because, that made a difference in my life that you can't even imagine.
We have provided over 1 million medical visits to the people in our community. That alone means that 1 million times we've been there for someone who needed medical care.
Camino Health Center has a rich history and continues its loving legacy of compassionate care. What was once a 2-room makeshift refuge for needy patients has become a thriving health center with 3 locations in Lake Forest, San Clemente, and San Juan Capistrano. The facilities are state-of-the-art and center around the patient and their needs. Today, Camino cares for over 15,000 annually of our most vulnerable neighbors who partner with our providers to focus on building a better life. What was once a glass jar for donations has become a $14 million budget, employing 100 of the finest caregivers. The health center now provides comprehensive medical, dental, and behavioral health services, along with the Women, Infants, and Children program. Our future plans include additional services for obstetrical and pediatric patients, as well as optometry care. We look forward to building a vibrant community where health disparities fade away and South Orange County leads the way in building a just future for all. We are so thankful for all of our community support from Arthur and Gay Bircher, the Camino Auxiliary, Mission Hospital, and the Sisters of St. Joseph of Orange, who helped us develop our loving legacy.